Doctor, my mouth opening was restricted all at a sudden. What should I do? Part 2. Hi everyone, this is Dr. Yin from Elite Dental Irvine. Last video, we talked about a patient came to me and all at a sudden, his mouth opening was restricted to 2.5 to 3 fingers. So we talked about the closed lock related to the temporal mandibular joint disorder, TMD. Today we are going to talk about the treatment. Let's take a look. The treatment for that is, if this really happens to you, I would urge you to see your dentist, specialist, or the oral surgeon within a week. Because within a week, this is called the acute state. It would be easier for your dentist or the specialist to manually maneuver your joint back to the correct position. What if you already missed this acute stage? Don't worry, from this review article it stated 75% of the closed lock is self-limiting, which means it might be recovered without taking any form of the medicine or treatment. However, if you do not see any significant improvement after 12 weeks, some treatment should be implemented. For the chronic situation, there are a few treatments that we can try. So first of all, I might prescribe my patient 800 milligram Ibuprofen, which is the NSAID, non-steroid anti-inflammatory agent. So it will reduce the inflammation of the muscle. The other thing I will tell him to try is, for the closed lock, when he opens his mouth, his jaw is most likely will shift toward the affected side. So I will tell him to try the home exercise, which means when he tries to open his mouth and when the jaw tries to shift toward the affected side, we can try to apply a force and against that shiftment. For certain percentage of patients, combination of the ibuprofen, the NSAID, and also the home remedy will actually help to resolve the situation. If that still doesn't work, you can try to go to your dentist or the specialist who understand the TMD. What your dentist can do is they can try to give you muscle relaxant. They can give you some local anesthesia injection and try to relax and numb the entire area. So in this way, dentists can try to manually maneuver your condyle back to the correct position and relationship with the disc. And after this, the special TMD device we call the anterior deprogrammer will be required to wear by the patient for a couple of days to prevent disc go to the forward position of the condyle again. And if this still doesn't work, the surgical innovation to reposition the disc back could be one of the options. However, oftentimes we try to avoid the surgical innovation. For the long run, as I mentioned in the last video, if the patient has bite the occlusal problem, I will still suggest to correct that occlusal problem, to help with the joint problem. Though some damage might already be formed, however, we can try to at least maintain it at a stable situation. The closed lock often happens to the younger or probably middle-aged patients, which means they still have a long way to go. I hope this video is helpful. See you next time. Bye-bye.